1,261 lab-confirmed cases, 1,815 new cases reported today, 1,179 people in the hospital, and sadly, 1,668 people who've died. Since our last update, we've passed the 100,000 mark of confirmed cases. This is a somber, serious benchmark. We pray for those who've lost loved ones to this virus. As we continue fighting COVID-19 on many fronts, I'm glad to announce today that North Carolina is delivering over 900,000 masks and other supplies to farm workers across our state. Agriculture is vital to our economy and our food supply, and it's a tough job that you can't do from home. This personal protective equipment will be delivered this week to the North Carolina Cooperative Extension Centers across the state and then be distributed to our farmers. The 31 counties that are home to 3/4 of our state's farm workers will receive the first delivery. This effort is a partnership among our Department of Health and Human Services, the NC Cooperative Extension, the State Department of Agriculture, the State Department of Labor, and the NC Agro-Medicine Institute. We must keep food in our grocery stores and on our tables. To do that, we must help protect the farmers and their families from this virus. I appreciate the collaboration that made this delivery of equipment possible. And speaking of protecting people from this virus, I want to take a moment to thank major retailers like Walmart, Costco, Fresh Market, and Lowe's, and so many other businesses, small and large, which are requiring face masks in their stores. This type of leadership, by example, shows the public that these retailers truly care about their customers and their employees. For those who continue to defy basic decency and common sense because they refuse to wear a mask, either wear one or don't go in the store. The refusal to wear a mask is selfish. It infringes on the life and liberty of everyone else in the store. Not only is wearing a mask the decent, neighborly thing to do, it's the best way to boost our economy. Meanwhile, North Carolina continues to focus on ways to make testing more accessible and more available to communities that need it. Our Department of Health and Human Services has expanded free COVID-19 testing to underserved communities that currently have limited testing sites. All of these efforts help move us closer to success. Now, as July draws to a close, many North Carolinians who are out of work are worried about the upcoming reduction in their unemployment benefits. The federal Pandemic Unemployment Compensation Program offers people an additional $600 a week to unemployed workers who've been out of work through no fault of their own. This program has been a lifeline for families and their communities, giving people the ability to pay their rent or utilities, to put food on the table, and to make ends meet. I am urging Congress to act quickly to extend this benefit. Though we right now are adding jobs back into our economy, and that's good, folks are still struggling, and many are still out of work. So far here in North Carolina, we have paid over 815,000 people more than $6.2 billion. And it'll hurt these people and our economy if their benefits are drastically reduced. We've seen the dire consequences of reopening too early in places around the country. Their hospitals and ICU beds are full, and the virus is worse than it was in March and April. Many people cannot safely go back to work. They can't go back to their jobs, and many don't have jobs to return to. And while this virus continues to spread, we have to support these workers and their families. This extra $600 has been especially important here in North Carolina, where the legislature several years ago slashed unemployment insurance benefits to among the lowest in the nation and made them available for only 12 weeks. While legislators were in session the last few months, they refused to do anything to help. When the legislature returns, I urge them to reevaluate North Carolina's own unemployment compensation to support people who find themselves sidelined because of this virus. Now remember, this federal funding has a multiple effect. It has a multiplier effect, really, going from families' pockets back into our local communities, helping small businesses and our economy stay afloat. This federal assistance will expire at the end of the week. The clock is ticking, and all eyes are on Washington right now. I encourage people to make their voices heard on this issue. With me today is our Secretary of Health and Human Services, Dr. Mandy Cohen, our Emergency Management Director, Mike Sprayberry, and Secretary of Public Safety, Eric Cooks. Karen Magoon and Monica McGee are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. I will recognize Dr. Cohen at this